Under the needle, where acupuncture meets anatomy. Today, we're exploring bladder 40, one of the most commonly used points in clinical practice. Bladder 40, or Weizhong, is located at the midpoint of the popliteal crease, between the tendons of the medial and lateral hamstrings. Palpation typically identifies a soft depression at the back of the knee, within the popliteal fossa. This region represents a key anatomical space where major neurovascular structures pass between the thigh and the lower leg. Because of its central location in the posterior knee, bladder 40 serves as an important access point to both muscular and neural pathways influencing the lower limb. Beneath bladder 40 lies the popliteal fossa, a diamond-shaped anatomical space containing critical neurovascular structures. The tibial nerve travels through this region, providing motor and sensory innervation to the posterior leg and plantar foot. Alongside it are the popliteal artery and vein, which supply blood flow to the lower limb. The borders of this region are formed by the hamstring tendons, including the semimembranosus medially and the biceps femoris laterally. Because of these dense anatomical relationships, stimulation at bladder 40 may influence both neural signaling and vascular dynamics in the lower limb. Clinically, bladder 40 is one of the most frequently used points for low back pain and posterior chain dysfunction. Tension in the hamstrings and fascial structures of the posterior leg can contribute to altered biomechanics throughout the spine. Because the tibial nerve passes through this region, stimulation may also influence neural pathways connected to the lumbar spine. Bladder 40 is often used to address stiffness, restricted mobility, and tension patterns that extend from the lower back down through the legs. In traditional Chinese medicine, bladder 40 is considered the command point of the lower back and is frequently used in the treatment of lumbar pain. It is also associated with clearing heat and regulating the bladder channel along the posterior aspect of the body. From a modern anatomical perspective, this region contains the tibial nerve and major vascular structures, as well as key components of the posterior muscular chain. These structures connect the lower limb to the pelvis and spine through both mechanical and neural pathways. When viewed together, these traditional and anatomical perspectives help explain why bladder 40 has such a strong clinical effect on the lower back and posterior chain. This is just one example of the anatomy we explore. If you want to study all acupuncture points systematically, deepen your clinical understanding, and earn continuing education credits, the Anatomy of Acupuncture Atlas and the full online course walk you through the entire framework. You'll find the links in the description.